Joseph, before you said you had problems with getting paid for the job you're doing here. Could you start first with describing what job you do?
Okay. Let me start with this. I requested for a job, which is the cleaning of the compound, of which I was given. And after completing the job, for them to pay me the job I work for, of which it was unfortunately that I did not get the money. I was not paid for it. I asked why. She told me that the time that I was given to do the job, that I did not do the job according to the time. I said, why? She said, you gave me the time, of which I followed the time. Now it's time for money to be paid. Now you are telling me that I did not work.
So he's right about what he's saying precisely, but the problem is
I have the evidence right here.
he has evidence about the hours because she showed him the hours at what time he was going out of the camp and inside the camp. And using that shows how, I mean, come on, for 80 cents per hour, 80 cents per hour, that's how much we get.
And you got 80 cents per hour, huh?
Yeah,
Oh,
and
yeah, he didn't get any. He didn't get any money at all,
he
right?
didn't get any money.
Yeah.
And that's not even the problem. The problem is that they tell you that you don't have to follow the hours. You have 3 hours per day, but you can do them whenever you want.
Anytime.
Yeah, but with him, she was picky. Why?
And who is she?
So, but she says like because you exited and re-entered the camp that day, you could not have worked.
Yes.
But you only exited and re-entered like for you've been out of the camp for maybe like I don't know 2
Yeah,
or
for
3
many
hours.
times.
He showed me the paper, and in the paper you can clearly see that he went out of the camp maybe 6 or 7 times in a day. And like the 13th, the 14th, the 15th, the 16th,
Yeah,
he has all of it.
So and then she said like you couldn't have done the job because you exited.
Yes.
And how many hours were you supposed to work each day?
3 hours.
3 hours.
But you don't need 3 hours to clean a compound.
Yeah. And for 3 hours you get 2 euros and 14 cents.
Yeah, 80 cents per hour.
Yeah.
The money that they haven't paid, actually.
Yeah.
So
They
if,
even didn't pay that much.
and if you get a person to clean and do that job, you would earn much more than that.
Which I was not paid for the job.
So do you do the job now?
Now? No. I stopped. I said I cannot continue.
مجارير اصلا انا شوي مسكره من ريحه المجارير.
So basically saying that it smells like shit everywhere, and his nose is he's getting basically a sickness because of that. His nose is always closed. He can't breathe anymore because of all that shit that's coming that's all around.
And can you ask him if he goes to school in the
عم بتروح على المدرسة شي بالكامب.
اليوم ما كنت تروح لا رجعت صار
He
رجعني.
couldn't go today because he vomited and he has a headache because of the bad food that he's eating and because of the cold milk that he's drinking instead of being hot milk. And unfortunately, I mean, if you even look at the coffee and the tea, it's all dirty.
What do you think of the school here?
شو رأيك بالمدرسة هون؟
تالي مو كتير.
The teaching is not so good, and honestly it's true because it's like they force you to learn a language where you are simply forced to learn it without understanding it at first, understanding the basics. So you have to complete a sentence, but how are you supposed to complete a sentence if you don't know the words?
Have you been to the course in the camp, inside the camp?
No, but a lot of people
Have you
here.
been there yourself?
No, a lot of people have
Me
been
too.
there. He's been there, and they're all saying the same thing.
One more question to Ahmed. The classes. How many people are in the classes, and of which age are the
كم
kids?
شخص في بالصف؟ يعني انت اللي عم تشوف واذا في ولاد انتوا لحالكم بتكونوا بالصف.
اثنين وبنت عم.
So there's there's like 3 people studying right now, 3 kids.
3 people.
3 kids. Because there are only 3 kids in the
انت
camp.
بس لا there's more. كم ولد فيك كم؟
نحن بالنسبه يعني بقول لك 3 بالصف بس في غير صف غير طبعا هلا خليني بالاشياء فهمت علي؟
لا هو قصدي انه بس هو بشكل عام في ناس عم تدرس كثير، في ناس عم تروح تدرس.
ما وحتى اختي انسه عم تدرس اختي.
الانسه لحالها عم بتدرسها.
اشياء عم تعطيها. عثمان.
دروس رياضيات
So that they're, instead of teaching them the language, they're just giving them drawings to do and
Drawing. Nothing to
nothing to
relate
actually
to
relate to the
language or
حتى ضجيج الورشة حد المدرسة ضجيج ما عم
Yeah, and
نسمع
even the construction right now, they're trying to put a building down. It's all next to the classes basically. It's all next to the people who are living in the B3. And what they did actually, they closed the B3, sorry, and they opened the B4 and they sent them all to the B4 instead of splitting them. And they put all the people in the B4, which is close to the construction, and the construction is even close to the classes. And it's too loud the whole day.
all the time noisy,
All day
loud.
from the morning, from 8 o'clock in the morning till I don't know till the afternoon. And it's too much for the people here. I mean, if you want to sit outside and have a coffee, and you're living a stressful and depressed life, and you hear such sounds, I mean, come on. I mean, where's the logic in
Yeah.
that?
Milham, you were talking about Ahmed's wife's situation, that she's in a bad health situation, but no one is doing anything inside the camp. Can you tell us what's going on? What's the problem?
خبرني شو عم بيصير. So he came here 2 months ago and a couple of days. They came from Hamburg to أي camp? أول شيء.
كان في هامبورغ.
There was a camp in Hamburg.
دركنا حوالي 20 يوم والمرأة تعبت حالتين كثير. الحالة المرأة تعبت كثير فأسعفوها على المشفى. بركت تقريبا حوالي 5 أيام مريضة في المشفى. عملوا لها شوية تصوير للقلب لأنه معها صمامين مضروبات في القلب من اليونان وبدها عملية فورا، يعني حالتها حرجة جدا، فعملوا لها تصوير للقلب من داخل الإيد والإجر والحلق.
So basically, she had a problem in Greece, where because of all this stress and depression in life, and she got a problem with her heart. There's a part of her heart that needs to be fixed. It has to do with the pressure of the blood and stuff. And they took pictures of her heart and also through the lung. There's like a this camera that goes to the lung, and they did all this diagnosis.
تعبت المدام وبالنسبة للولد كمان كانت مكسورة إيدها يعني
So basically, they didn't ask for a transfer. They just asked using this to get a transfer because of his wife going through these problems, and she really needs a surgery where she needs to fix 2 parts of her heart, and it's really severe, and her health is going down. And his kid has a problem with his hand where he broke his hand, and it's been a month like this. It hasn't healed yet because of the bad nutrients, because their food is really bad here. It's like I mean, even if you live in a jail, you get better food than that. I mean, honestly.
وبالنسبة
And one more question. When he asked for that, for the transfer or to go to the city, what answer did you
شو
receive?
اجاك الجواب بس اعطيتنا هيدا الورقه فرجيتني كل
أعطونا
الأدلة.
هذا الجواب قال شو بدكم، قلنا له آخر شيء بدنا بيت، يعني بيت بالنسبة يكون قريب على مشفى. حكينا صحيح بالنسبة للترانسفير، قلت لهم بدنا بيت. حكي من شيء أسبوع ولهلا ما ردوا لنا.
He asked for a house, he asked for a place to be closer to Leipzig to get the treatment, because the treatments for his son and for his wife and for himself also because of the problem that he has in his blood, because of that bacteria. And كيف القصة شو اجاك شو الجواب اللي اعطوك اياه؟
الجواب قال بدك تستنى، وبالنسبة عند حكيناهم مشان هاي التقارير قال نحن ما عنا علم بهالحكي، وبرد قال المترجم أنا ما بيعترفوا على هالتقارير هاي، يعني إنه هاي مايش، إنه ما عندهم هاي التقارير ما هي معترف عليها.
Yeah, so
هيك بيقول المترجم،
basically
ما
what
بعرف إذا فهم عليها ولا لا.
so the translator that works with the social with the London Direction, the answer was given that this paper is not valid and we don't accept such a paper from Hamburg. It's not valid. And they told him he has to wait, and he's been waiting for a month. And this is like 20 يوم.
هلا صلنا تقريبا هون 21 يوم هون.
He's been here for 21 days now.
لايبزيج بركنا شهر 30 يوم.
And Leipzig for a month and شهر و30 يوم بلايبزيج.
يعني هلا شهر لايبزيج
وهون 20 يوم.
وهون 20.
Yeah, it's been a month and 30 days almost, and they haven't gotten
No answer till
no answer
now.
yet, or even an appointment for the doctor. أعطوكن شي موعد للدكتور؟
لسه ما أعطونا موعد
They
للقلب.
haven't gotten anything yet for her heart. The doctor for her heart.
So you asked for transfer, but it wasn't accepted because of the translator. The translator already blocked your request for transfer.
يعني أنت من ورا المترجم صار معك هيك، بدل ما المترجم يساعدك.
المترجم نحن حكينا له الوضع، بقى ما بعرف اذا فهم علي، بس قلت له قال كان عندك موعد دكتور للمرأة عند دكتور عام، قلت له انا
متى
دكتور-
هذاك الموعد؟
كان الموعد يوم اللي كنا بلايبزيج، كان عندنا دكتور موعد، ورحت عليها على الدكتور وعلى الممرضة، قلت لها نحن عندنا موعد بالعاده بيعطونا شيء اسمه كروت باص. ما اعطونا كروت باص، قلت لا اذا ما راح تعطيني كروت باص انا ما راح اقدر اروح. لو ما اعطونا كروت باص وحكيت له القصه
Yeah, so basically, the translator, instead of trying to help him, he told him that you had a meeting in Leipzig when you were at that place, at the camp, and you didn't go to that meeting. And he told him, yes, I'm not going to go to the meeting if you're not going to give me bus tickets, because we're not capable of paying tickets for the bus.
And the translator, you referred to that the translator actually didn't translate. Is he from Maltese or the translator from
هو المترجم جاي من السوسيال ولا من المالتيزا؟
لا من السوسيال،
من السوسيال،
ترجم
من
السوسيال. حكينا له القصه للسوسيال يعني شو صار معنا بلايبزيغ، وقلنا لهم ليش انتم مثلا حاله مرضيه بتنقلونا هون لبعيد عن المشفى.
And he asked them, why do you send people when they have a really severe problem, severe health problem? Why do you send them to a further away place which is so far away from the town, basically?
يعني عند المرأة مريضة وتعبانة ومعها صمامين بالقلب ومبين
Yeah, and he has proof for all the problems with his wife, with the heart problems, where she has to have a really fast heart operation, and it's really needed because her health is going even down and down, and she can't even walk anymore, even eat or anything else, and they don't care.
جابونا على هذا الكم. يعني اول شيء بدك تمشي ثلث ساعه لتوصل الباص، والباص
Yeah.
بده 3/4 الساعه ليوصل ليبزيغ، والمرة بتصير معها دوخه وبتصير بتراجع يعني لانه معها مرض يعني كثير يعني تعبت نفسيا.
So basically, part of her health problem is the balance in her body, the balance of her. So the problem is every time she has to walk 20 minutes to the bus station and then take a bus that takes almost 45 minutes to get to Leipzig, and all that, she's gone. Yeah, she can't handle it. I mean, her balance of her body is not really balanced anymore because of her problem in her heart.
So they have to call an ambulance.
Instead of calling an ambulance or call a taxi for them,
They do nothing.
and they don't do that. طلبوا
And
لك
the
تاكسي ولا
answer
طلبوا لك
they gave you
that's
that
what
they told it's
And they-
expired.
Yeah,
it's
not expired.
valid.
It's not
لسه ما
valid.
جابوا لنا
It's not
موعد
accepted.
بالدكتور.
It's not even like for them. This paper is nothing, and this comes from Hamburg from a specialist from a specialist that has to do with her heart.
But
A heart
they don't
specialist.
trust this
They
letter.
don't accept it. No, they said it's not valid. We don't accept something from Hamburg. That's what they said.
إن شهر و20 يوم عم نستنظر موعد دكتور القلبي، لسه ما جابوا لنا
Yeah,
موعد.
we've been waiting for a month and 20 days to get an appointment with the heart doctor, but we haven't gotten it yet. And this shows that she needs a really fast heart operation. Immediate
action.
heart operation. It's really severe.
And I remember it was a few weeks ago that you had a health problem.
Yes.
You went to reception. You had some problems. Can you tell us about it?
So I have a heart operation that I've had since I was 2 years old. Usually at this time of the season, I get allergies in my lungs and I get problems with my heart where I have to take specific pills and sort of a spray, like an oxygen spray, sometimes with cortisone. It depends what case you have. And I went to the reception in the morning at 4 o'clock, 5 o'clock in the morning, and I told them I can't breathe and I had a really problem with breathing. I was under stress and depression, and they called the ambulance for me, and the ambulance came and he tested my basically I had a high blood pressure, and he told me you need vitamins because you're not eating well, you're not taking the right nutrients, and which is very obvious because of the food here. And he told me that you're gonna have to see the doctor on Monday. So that was on a Saturday, and then the Sunday same thing happened to me again. And careful, he didn't give me anything to take. He told me just let it ease off and wait for tomorrow, and if that happens again, call us again and we're gonna try to help you out. And I called them again on a Sunday and they came again. I had the same problem, higher blood pressure, bad nutrients, problem with my lungs. I need something I need sort of a spray which is specific for my disease. And then I come on a Monday and I go to the doctor and the doctor's not here, and the doctor comes on a Wednesday. I mean, where does this exist in the world where a doctor does not come on a Monday, which is the first day of the week, the most important day? So if you want to tell me, oh sorry, that's according to the rules and the system, well, where does the system come from? Where's the logic in that system? I mean, you're waiting Saturday and Sunday without a doctor to wait for another 3 days? That doesn't make any sense.
And they only have one doctor in here.
They only have
for
one doctor, yes.
400 people, 500 people.
Yes,
that
almost
is
that
not
much.
coming regularly.
Yeah, sometimes
It
you
is
have.
insane.
Yeah, it doesn't really come regularly, and not only that. I mean, he took a blood test for me, and he told me that you're gonna get that result. That you're gonna get the results in 3 days, and I've been waiting for 2 weeks now. And he told me he's gonna give me an appointment with a heart doctor, a heart specialist, and I've been waiting for a month now almost. And that doesn't make any sense. I mean,
And
what's going on
your
here?
disease is heart disease actually
Yes, I have
something
a-
that needs immediate action.
Yes, of
you
course.
shouldn't have wait.
Of course. Yes, I have a big problem, and I've had it since I was young. And
have-
every year I have to do a checkup.
And have you talked about your problem with people in basics, with the management? Have you talked to them
I've
about
told
your
them.
problem? And
Yes, I've told them. They told me that when you get in any problem, you see, I fell on my back. I have a problem with my spine. I fell on my leg here because of the ground, uneven ground. I have a really big problem here, and it's not because of them. It's because of my own mistake. But it's their responsibility to care about this. But unfortunately, they're not well trained to tell you exactly how you should handle the situation. They didn't even tell me to put a gel on my leg or to put some kind of material to fix my leg or anything else. They just left me alone. They told me just put some ice and that's it.
that was the answer that you got
That
from
was the
them.
answer. And I wanted to go to the doctor, and the doctor doesn't even ask about you. Like usually there's a relationship between the doctor and the patient, and it's a very strong relationship, and it should be like that. And
But
it's very
here
normal.
it's not
They don't have that
happening.
here. Here you just go to the doctor. He tells you a couple of things. He gives you a medicine, and and you know the funnier part. He gave me the wrong medicine. He gave me a medicine with cortisone, which basically is for bronchite, and I don't have that. And I took that, and I got bronchite because of that shit. Look, they just have to fix this place where they should make us feel more happy, more
Comfortable.
decent and comfortable, because we don't live in a comfortable place at all. At all. There's not. I mean, okay, we play volleyball, we enjoy our time, but that's not enough. Because, I mean, even if I play volleyball or do those entertainments, I'm not even enjoying them anymore because of the vibes, because of those bad vibes, and it's unfortunate.
Yep, thank you very much.
You're welcome.
Wilhelm.
Thank you so much. You're welcome.
Yeah, thanks for the interview.
And I hope someone helps us and thinks about us and really realizes that we are people who come here to this country to actually live a decent life and have a stable life because of our governments, which are all mafias according to our perspectives, of course, and I'm not the only one. And we just want someone to care about us. That's it. We don't want anything else. We really are here to learn the language and learn the life and the tradition of the people, and we respect everyone. We have nothing against anyone at all, but we just want someone to actually keep an eye on us and not have such people take control of our lives and decide our destiny, decide our lives because of their own psychological problems, because of treating us just as they treat a murderer or a person who came from a country because of bad stuff that he did in this country. Because not all of us are like that. Some of us came from our countries, we lived a nice life, we lived a rich life, we lived a beautiful life, but unfortunately, I mean, if you have a corrupted government, that's what happens to you, and that's why you have to leave the country. And also because of other personal reasons, which we all have. Everyone has his own reasons. So I just hope that we all treated equally. That's it.
Hopefully. Yep.